Next talk, which is given by Jaffa. Jaffa is a senior policy manager at NHS England CYP transformation program, and he's going to give us an update on what's going on.
Hi, afternoon, everyone. See if I can get this clicker to work. Oh, yeah, perfect. Great, so good to see you all. So my name's Jaffa, Senior Policy Manager at NHS England's Children and Young People's Transformation Programme. Just to give a little bit of background before I start to our programme, so the Children and Young People's Transformation Programme was set up in 2019 on the back of the NHS England long-term plan and on the back of the commitments made towards children and young people within that plan. And there are three guiding principles towards our programme. The first one is around integration and what does integrated care look like for children and young people, thinking broadly in terms of healthcare integration, so between primary, secondary, tertiary care, for example, but also wider in terms of integration between healthcare, education, social care, and the voluntary sector. The second area of focus in our programme is around improvement, so improving the quality of care for children and young people with, for example, long-term conditions such as epilepsy. And the third guiding principle for our programme is a real commitment towards ensuring that the voice of children and young people, their parents and carers, are also included throughout the heart of our policy development. And in our epilepsy workstream, we have a really strong partnership with Young Epilepsy and also continuing to work with colleagues at the college and the youth advocates, hopefully going forward in the future as well, to make sure that their voice is included as we continue to develop our programme. So specifically within our epilepsy programme, we have 4 key areas of focus that guides our programme, and these are very much evidence-based areas rooted in the Epilepsy12 audit. So through successive rounds of the Epilepsy12 audit, these are areas of focus that come into attention, as well as being developed with young people and with lots of colleagues sort of working within epilepsy and key stakeholder groups such as Open UK and the audit team. So just to quickly go back, so the 4 areas of focus. The first area is around supporting the mental health and well-being for children and young people with epilepsy, and that follows on nicely from the previous presentation. The second area of focus in our programme is around improving referrals into the tertiary services and into the CES or CES, depending on I think where you're from in the country, but the Children Epilepsy Surgery Service. Third area of focus is around improving transition care from paediatric to adult epilepsy services. And the fourth area is around addressing variation in care delivery with a specific focus on epilepsy specialist nurse access. In terms of our delivery infrastructure, we have a national oversight group, which is co-chaired between us and NHS England through Simon Kenny, who's our National Clinical Director, but also co-chaired with Young Epilepsy and Mark Devlin from there. And we also have a really critical regional infrastructure. So for those of you who may not be familiar with sort of the setup of NHS England, we're separated into 7 regions. And each region has a dedicated clinical leadership team for children and young people's epilepsy, which is now in place. So our programme was set up about a year and a half ago now, and we now have a full complement of clinical leads across the country to support delivery of our programme. But also really crucial to our delivery are the networks, so the Open UK networks, who are really the clinicians on the ground doing the doing, but in collaboration in this sort of symbiotic relationship with our regions are there to deliver our programme. So this year we're really excited to be able to launch two pilot programmes. The first one is our integrated epilepsy and mental health care clinics. And these are based on the intervention some of you may be familiar with in Scotland called PAVES, so the Psychology Adding Value in Epilepsy Services, alongside integrating within that the MICE intervention as well. And our second pilots are our epilepsy specialist nursing pilots as well. So just to very quickly go into our epilepsy and mental health care pilots. I don't think this is an audience that needs convincing around the importance of this area. But we do know, as we've already heard, the increased incidence of mental health conditions with children and young people living with epilepsy. But also from the audit data, we also know that only 20% of trusts in England had any form of formal mental health screening integrated within their clinics. And nearly 30% of trusts didn't have any agreed referral pathways into mental health services. And alongside that, we also can see the really strong emerging evidence base, firstly of the PAVES model in Scotland, and also, of course, of the MICE intervention, which we just heard. So we have 7 pilots across the country, and broadly the model of care is as follows. So it starts off with screening. So every child will be invited to take part in mental health screening using a digital screening tool that we've procured for the pilot sites. This will then lead to the results being sent to the clinicians directly into their inbox. And that will be correlated with a traffic light rating score, so a RAG rating, so red, amber, and green rating as a decision support tool for the clinicians. So it's important to emphasize that the traffic light score is a decision support tool, it's not a decision making tool. Clinicians will obviously have the freedom to be able to interpret results. But these traffic light scores are linked to a stepped care intervention pathway. And broadly, these are the interventions, so all the way from self-help resources for patients that may present with lower clinical risk, all the way to referrals into the mental health services for patients that have a higher risk. But within that stepped care pathway, we have other interventions such as signposting to the voluntary care sector, parent and carer groups, and it was really interesting to hear from the youth advocates earlier around sort of their feelings on the importance of parent and carer support. So really looking forward, I think, to working with them a bit more and thinking about what those interventions might look like for our clinics. Peer support groups and group interventions, and then of course we've got the MICE intervention firmly within that stepped care as well. Just to quickly flag that with the signposting to the voluntary care sector, we've got a partnership with the charity Chasing the Stigma, which has a tool called Hub of Hope, which is essentially a electronic or digital directory of services, and we'll be working with the charity so that across the pilot footprints, they'll be able to identify particular organisations that might be deemed epilepsy friendly to be able to support young people. And there will be some local variation across our pilot sites as well, depending on local pathways and workforce. So these are where the pilots are located. Some of them have already started and successfully recruited. Some are still out for advert, and we're hoping that perhaps next year, if we're invited back, we'll be able to give a bit of an update on outcomes from the pilots as well. So very, very much looking forward to this pilots kicking off soon. Our second group of pilots are our epilepsy specialist nursing pilots, and again, I think this is an audience that's already converted around the importance of epilepsy specialist nurses, but they really are that golden thread that runs through delivery of quality, consistent quality services. And we know lots of evidence out there around access to epilepsy specialist nurses leading to decrease in emergency admissions, really key role in supporting continuity of care between different care settings, and of course some economic evidence as well around cost effectiveness of access to epilepsy specialist nurses. And despite the audit showing that there has been an improvement in access over the years, we still see, when you dig into that data, some real significant variation when you look at individual trust level or at integrated care board level. So there is still some significant variation there. And so we funded a whole number of epilepsy specialist nurse posts across the country, really with a focus on system working and working across provider footprints. Again, lots of these posts are out for recruitment currently, but some of the models of care, there's a whole variety of different models that they'll be testing out. But for example, some of them are around developing pathways with community paediatric services to facilitate assessment for neurodiversity, so learning disability and autism assessments, for example. Some of those epilepsy specialist nurses have plans for joint clinics with community learning disability nurses. Supporting schools to develop individualised school healthcare plans, which we heard earlier is still an area of need for improvement within the audit, from the audit data. So lots of different models, and I think there'll be lots of really valuable learning that we'll be able to generate from these pilots. Another thing that we're starting, which we're about to kick off in the next few months, and this is something I'm really excited about, is some work we've got planned with the Health Economics Unit. So these are a group of health economists and analysts, to start doing a bit more economic modelling within epilepsy services and to try to identify where the most value-added care options are along the care pathway. So really looking at a whole load of inputs, such as mix of professionals, presence of satellite tertiary neurology outreach clinics, for example, medications management, and then looking at various outputs, such as prescribing costs, emergency admissions, number of outpatient attendances, and starting to look at that sort of care outcome relationship to determine where the greatest return on investment lies within the epilepsy care pathway. And really the objective behind this is to support integrated care boards who are now responsible for commissioning epilepsy services to have an evidence base to be able to make those decisions. And I think there'll be some really interesting findings that should hopefully come out from this piece of research, which will be beginning in the next few months. In addition to that, NHS England this year undertook a review of the RESCAS service, which was chaired by Alistair Parker, who's here today. So this review for the RESCAS service, so just as background, RESCAS is the Refractory Epilepsy Specialist Clinical Advisory Service, which is a bit of a mouthful, but thankfully has a nice acronym. This service is a clinician-to-clinician service for tertiary care neurologists to be able to access specialist advice, specialist MDT team advice from colleagues at Great Ormond Street Hospital for patients with refractory epilepsy. And this review found that clinician satisfaction with the service was very high. I think it was on average over 9 out of 10, so really high satisfaction with the service. Clinical benefit was reported in over 95% of cases. However, there probably wasn't as many referrals into the service as expected when the service was originally commissioned. But the review found that the service should still continue to be commissioned, but also with a bit more work to be done around increasing referrals. And part of that is a bit of a campaign, I think, to increase the visibility of RESCAS through events such as this. And I'm sure Alistair will be happy to answer any questions on the review afterwards as well. But yeah, pleased to say that I think the review found that the service should continue to be commissioned going forwards. Something else that we've done, and I think last year when we presented to you, we alluded to some work that was being undertaken around health inequalities within NHS England. So we have launched in the past year the Core 20+5 approach towards addressing health inequalities. So for those of you who might not be familiar with Core 20+5, this is the NHS England approach towards supporting improvement in healthcare inequalities through defining a target population, which is a Core 20 populations, the individuals who are in the 20% most deprived population. Plus groups are groups that may experience poorer than average experience, access and outcomes, and 5 key clinical areas. And we've made sure to include within the 5 key clinical areas epilepsy, as we know the links between epilepsy and that sort of social gradient in terms of the diagnosis of children and young people with epilepsy, as well as research from the LEDA review, so the Learning from Lives and Deaths of individuals with learning disabilities and autism, showed that children and young people with epilepsy aged 4 to 18 were in the category of sort of one of the most common causes of treatable deaths were children and people with epilepsy in that age group. So some clear health inequalities associated with epilepsy and, as I said, epilepsy firmly within the overall NHS England approach towards addressing health inequalities. And this is a really important, I think, win for epilepsy, because what it does do is it really raises the profile of epilepsy and paediatric epilepsy, as every integrated care board will have to include the Core 20+5 within their future strategies. And so I think epilepsy definitely has an increased profile from being within this. Very quick shout out again to the EQUIP program. So again, really pleased that we're able to support that again going forward, and looking forward to seeing the range of projects that come from that, hopefully align to our 4 areas of focus as well, and lots of learning I'm sure that will be generated to support services. And finally, really pleased to be able to, I guess, exclusively reveal for the first time that we have got final sign-off to be able to publish the National Bundle of Care for Children and Young People with Epilepsy. So this is a document which was really developed in collaboration with lots of people, many of whom in the room today. We had engagement with over 100, I think, clinicians, commissioners, reps from ICBs, to develop this document, which is a supportive toolkit for integrated care boards to be able to assess their epilepsy services. So we have really clear within this document, really clear standards of care, evidence-based standards of care around what good quality epilepsy care looks like, many of which is based on NICE guidance, but with some recommendations for integrated care boards to be able to map their services against those recommendations and those standards, and to undertake some gap analysis to see how they are against those good practice standards. As I said, this is going to be coming out imminently, so in the next few weeks, and I think as soon as we're able to share the link, we might be able to send it out to everyone who's registered for the conference as well, because it'd be great to raise a profile of this. But again, this document is aimed at integrated care boards who are responsible for commissioning epilepsy services to be able to understand their services better and to hopefully improve services in line with the recommendations within that bundle of care. That's it. So thank you very much. Happy to take any questions. Yeah, sure.
Thanks for that interesting talk. Can I ask about the pilot for the epilepsy specialist nurse? Why is it being referred to as a pilot? Because they've been in existence for a long time, and we all know that they help. So
yeah, no, it's a great question.
What are you trying to prove? Get some evidence that they really do help?
So no, so absolutely, the evidence base is really clear around the effectiveness of epilepsy specialist nurses. Part of it is, I think, semantics in terms of funding to get funding for the posts. But I think also there is a real focus that we want within these posts to have a focus on system working. So looking at working in ways that some epilepsy specialist nurses already are working across different provider footprints, but with a real focus on how that looks like on the integrated care system level. So working across secondary care community teams, for example, as well, through education as well. So lots of focus on that system aspect of working. But you're right, the worth of epilepsy specialist nurses has been clearly proven through lots of research, and is of course a nice standard as well.
Thanks. Just following on from that last question. So it sounds like these epilepsy specialist nurses will be working potentially in a slightly different way, as you said, across organisations. And I just wondered, had you had thoughts about how those nurses would integrate with the epilepsy nurse specialists in the individual institutions? I'm just thinking, for one of the main roles of nurse specialists is often as a contact point for the families.
Yeah.
And potentially this would add another epilepsy nurse on top of perhaps two others that already exist if they're under a tertiary centre and a secondary centre, both with nurse specialists already. Then this may now be a third. And is there a risk of causing some confusion, or how those three nurses potentially might work together? It's just a kind of possibility that there might be added complexity as well as added benefit.
No, so it's a great question. I think parts, again, the models will all be very different within the pilots, if I can use that word still, within the pilots. But so the role for the system leadership role, for example, that will be working more sort of with commissioners, with services at the kind of the management level, if you like, as opposed to being a point contact for a young person when they are undertaking those sorts of system leadership roles. So, for example, working to develop pathways, working to develop training programs, that sort of stuff. So it won't necessarily be a point contact for a specific child or young person in that sort of model. But again, all the models do look quite different and vary. But absolutely take on the point that one of the main benefits of epilepsy specialist nurses is that contactability aspect, and not wanting to confuse that, I think will be an important consideration for the pilot sites. But the system leadership role is working at a slightly different level than direct patient care.
So we got one question online, which was, will the digital mental health screening tool that you described be widely available across all services?
So at the beginning, it will just be for the pilot sites, and then as we assess the evidence base, we'll be able to determine future potential wider rollout. But for the moment, it will just be for the pilot sites as we're testing it. Okay. Or we could go to coffee break early. That's all right.
Just in that last question, I think the screening tool is going to be the strengths and difficulties questionnaire, isn't it? So that would be available to all services currently.
Yeah. So the part of the screening tool will include the SDQ element to it. The sort of the traffic light rating and the algorithm behind that is part of the tool. Yeah. But yeah, you're right. The SDQ is available. Okay.
There are no other questions.
All right. Thank you very much. Thanks.